problems we see with children in Singapore is repetitive strain type injuries, and this is often due to the fact that there's no seasons in Singapore, so all year round they'll play football or they'll play netball. In Western countries or other countries that are more towards the poles, we'll tend to see summer sports, which may include cricket or surf lifesaving, and then in the winter they'll play football. And so the one sport through the whole year tends to increase the amount of repetitive strain injury we tend to see in children, like Osgood Schlatters and some of the things we'll talk about later, severs, which are insertional problems. And in children, they usually involve bone. So the weak part of the structure in a kid is their bone and their growth plates. And thus we need to have a look at trying to get them varying the amount of sports they're doing and being careful of the load of sport. So children in Singapore here, we're talking say anywhere from 12 to 16, can play up to 10 to 12 hours a week of organised sport, and it tends to make them much more susceptible to things like the insertional problems in the knee with the Osgood Schlatters and also the severs. So to try and reduce, have a look at their load, be a bit careful when they come back after the summer, the European summer holidays, that they increase their load very quickly after being very lazy at home during the summer, and then finally look at a variation of sport through the year, so they're not just playing football for 12 months a year but varying it up. And there's some of the things that are specific to an increase in repetitive strain injuries, especially affecting the structures of bone, that we tend to see here in Singapore.